Patient scheduling. We have appointments on November 25th and November 26th. Depending on your practice, some offices make appointments in 15-minute time slots, some in 10-minute time slots. Let's read the bottom. NP, new patient. It's important to indicate if the patient is a follow-up patient or a new patient. The new patient has not been seen in the last 3 years. EP is established patient. This is a follow-up patient that has been seen in the last 3 years. Check-in receptionists need to know what paperwork to prepare for the patient's visit. Also, physicians like to know how to plan their day. Some offices schedule in 10-minute blocks and some in 15, so just follow your office protocol. Double booking. That is scheduling 2 or more patients in the same time slot. If you are handwriting the appointment schedule, use a pencil. Many patients call and cancel their appointments or reschedule their appointments, and you would like to be able to make that change. Now let's look at the calendar at the top. On Monday at 8 o'clock, we have a new patient, Jane Jackie. And of course, you include the phone number. This practice for new patients take 30 to 45 minutes for new patients. In red, I have LoJack and Jim Jack. They must be related. The phone number is the same. And that's probably why they're in the same time slot. And once again, that's called double booking. On Tuesday, those are in 10-minute blocks. The physician has blocked out from 8 to 8:30. At 8:40, they have a new patient, Bobby Jackson, coming in. And they did ditto marks, and they're taking up 45-minute time slots. And then we have an established patient, Dave Jones. At 8:40, we have a new patient, Bobby Jackson, and they are taking up 4 time slots. And since they're in 10-minute slots, that's 40 minutes. They also put established patient, Dave Jones, in the same slot with Bobby Jackson. That's also called double booking. Let's review. List the most important information obtained for scheduling in a patient's appointment. What is double booking? Number 2, when a patient cancels the appointment, what are your responsibilities? Number 3, demonstrate the proper way to make a correction on the patient's documents. Number 4, appointments are usually scheduled in what time increments? Number 5, how do you handle a patient at registration who cannot read or write? Number 6, define confidentiality in your own words. Number 7, define release of responsibility. This is a completed encounter form, the date of service, the charges, the amount the patient paid, the balance, the patient's name, and the number 34328. Some offices have pre-printed encounter forms, and they're numbered just to make sure they're able to account for all of the encounter forms. The top part of the encounter form are the procedures. The doctor checked the procedures. The checkout receptionist indicated the amount charged. The bottom part of the form are the diagnoses that the doctor checked. It's important that that form is filled out by the physician so the billing department will know what to charge the patient. And you have completed the Medical Office Clerical course. We also offer certificate programs for Medical Office Assistant, Medical Billing Specialist, Medical Office Lab Assistant, EKG Technician, Cardiovascular Tech, Medical Transcriptionist, Chiropractic Assistant, and Limited Medical X-Ray. We also have webinar programs for HIPAA, Medical Billing Specialist, Medical Office Receptionist, Medical Transcriptionist, Clinical Assistant, Medical Office Lab Assistant, Medical Office Lab Assistant, BSI and Infection Control, Phlebotomy and Injections, CLIA, EKG Technician, EKG Interpretations, Stress Testing, and others upon request. Please visit our website at www.catscareers.com. Now on to the workbook.